Hey, Cameron, Jahan, Phillip, uh, anybody else, Danny, Sanjal, the white dots or FA, fluorescein angiography?
I like white dots.
Perfect. All right, two people white dots, let's do white dots.
White dots.
All right.
White dots.
All right, cool.
White dots, sure.
Let's do white dots. All right, white dots. So this is what the BCSC is like, and the BCSC terrified me. So I had to kind of learn it a different way. So if you guys have any questions, let me know. All right, these are my pictures for what the white dots mean. All right, if you have glasses falling down, it means myopic. You have a picture of a camera, means photopsia. Cloud, like hazy with a little bit of rain, is vitritis. A blind cane is an enlarged blind spot on visual field or on confrontational visual field. If you have a napkin box, it means the person's having a viral prodrome. And then a sword with its sheath means vascular sheathing. And then this wave just means it's a wave on a ERG. Sometimes it could be a B wave, sometimes it could be an A wave. And then the injections mean steroids. Okay. Who wants to take a stab at this? All right, these are hard. Okay, so don't be let's do man, I hate picking up people. Let's do Caden. Are you there, Caden?
I am. I just got the slides to come up. So were there any other images before this or just these pictures here?
Just these pictures.
Okay.
What do you think the diagnosis is?
So
Yeah.
with vascular sheathing, I'm thinking about some sort of vasculitic process.
They're all white dots.
What'd you say? Oh, they're all white dots. Okay.
So we'll look at the top left picture. So describe to me what you see in the top left picture.
Okay, so it looks like I'm seeing some well, I'll just start. It looks like a color fundus photo. The disc to me looks like it has some areas of either edema or exudates kind of radiating out from it.
Okay.
And then moving out, the actual kind of fovea and parafoveal area looks okay, but then moving out, we kind of have a series of white dot areas in the mid periphery.
Good. Where do you think it's emanating from? Like, could you imagine, like, if there was a central focal point that it began from, and now it's like kind of like splaying off? Like, where do you think this is coming from? You know what I'm trying to say, or no?
I mean, it looks like it's originating from around the optic nerve.
Exactly. So imagine. So what do you think this is? Do you kind of have a clue, or not really still yet? Imagine you put a shotgun behind the optic nerve and you blasted the shotgun, and those are the sprays of the shotgun.
Okay, it does have that kind of birdshot appearance.
That's birdshot. What is the picture in the bottom left? What kind of picture is that?
So I think this is an autofluorescent photo.
This actually, because of the haze of these vessels, is an ICG. Kind of has this kind of appearance.
Okay, so that explains why you're seeing more choroidal vessels.
Yeah.
Okay.
The number one test for birdshot is actually an ICG and not an FA. ICG will show you those little dots right here. These are the little birdshot dots that are splaying off coming from like the nerve better than an
Okay.
actual fundus photo could. Sometimes somebody with birdshot can have a normal fundus and you do an ICG and then you'll start to see those birdshot appearance.
Oh, okay.
Okay. All right. Well, what do you think the demographic is?
So demographic usually for these patients is going to be a kind of younger to middle-aged female patient.
Good. Excellent. All right. What about any kind of symptoms? What kind of visual complaints will these patients have?
So visual complaints, I think the big ones are going to be blurred vision and floaters.
Excellent.
And then a little bit less common would be things like photopsias or maybe dyschromatopsia.
Perfect. All right. Clinical signs. I think I even forgot that one. What kind of clinical signs will you have? How about we just skip? What kind of association is associated with birdshot?
So you're saying from like a systemic disease association?
No, I'm talking about labs.
Or labs, okay. So the big one is HLA-A29.
Man, good. And then imaging, we just talked about ICG.
Right.
And then what's the treatment for it?
And then to treat it, so you're probably going to need for an acute flare, well, oral steroids help, but they don't help fully. So they're probably going to need more of a like systemic immunomodulator like cyclosporin or mycophenolate.
Nice. Nice. So the first thing we all have to pick up is what the picture is. And the way to do it is just remember that if you see something that looks like it's emanating from the disc, then just imagine like you had that little shotgun behind the nerve, splayed it, and then all these sprays come out. That's going to be the birdshot. That's why it's called birdshot.
Yeah.
Okay. This is how I remember. I don't know if anybody watches Always Sunny in Philadelphia. They call her Bird on the show. And this is Dee Reynolds, white. She's white females, usually 40 to 60 years old. And just like Hayden said, you'll have color vision issues, you'll have photopsia, you'll have blurred vision and floaters bilaterally, and you'll also have nyctalopia. Clinical signs, you'll see some vitritis. I forgot to mention that. It comes in a radial distribution, which you could see over here, kind of a radial distribution. And then you'll also have venular sheathing along here, and that's what causes patients will also have CME. So I've had a couple patients, girls, 25 years old, they have CME. You don't know why. They're having vision changes. It's in both eyes. They don't really have this classic like birdshot appearance, but if you did an ICG, you would see it. And they usually have birdshot. It's associated with HLA-29. Just think of a fighter jet, that's HLA-29, and all these birds, so they kind of fly together. Oh, and this is a good one too. So on FA, so ICG will really pick it up really well, but on FA, the term that they like is that there's quenching, meaning that the vessels kind of absorb, the dye fades very quickly on the FA. So I just think of the bird having a Sprite bottle because it's quench your thirst. That was Sprite's logo. And then the last thing is they do an ERG. Just remember like a little baby bird on the wave. So it's a diminished B wave on an ERG. This is different than all the other white dots, which usually have a diminished A wave. Birdshot is the only white dot that's kind of weirdly different. It has a diminished B wave. I've asked retina specialists why, they don't know why. And last, imagine the bird taking steroids, but also just like Kaden said, IMT. Kaden, great job, man. That was really hard. Did very good. So this is whenever I have a test and they're testing me on birdshot, I just have this one picture in my head, and pretty much there's nothing else they could test you on. Okay.
Hey Mo, real quick.
Yeah.
Sorry, my audio video cut out for a little bit. Did you say that there is systemic association or no?
No, no, not really. Just the A29 was what I was looking for, the association.
Okay. But it's usually just an isolated eye condition and there's not systemic involvement. Okay, great.
A
Thanks.
patient can always complain of fatigue, but it's usually not taken so strongly as like the other white dots. But they may always say, "Oh man, yeah, I do feel a little run down," but it's usually more with mudes. It's usually more with ampy. Okay, Carl, keep going. What do you think this is? Oh, you're on mute, but
Okay, thanks. This looks like mudes, maybe.
all right. How about this? Ready? Do you feel like, okay, so what's the first picture? What kind of photo is that?
All right, so we have a color fundus photo, clear media.
Perfect. And what's this picture over here?
That is an FA.
That's an FA. Good. This is an early FA. This is a late FA. And then what kind of photo is this? This is an FAF.
Also, FAF. Yeah. Okay.
Yeah, this is an FAF. So now, and the way that I remember FAF is FAF usually has the black disc. It's FAF is
Okay.
black. Okay, so now you have multiple photos. You've got color photos, you've got an FA, and you've got an FAF. Let's look at the FAF first. I like the FAF because it's kind of just takes out all the interesting stuff and just gives you like the black and white plain stuff. The black and white, do you see single stuff or multiple stuff?
Multiple.
Perfect. Okay, and if you were to pick like the biggest one out of the bunch, maybe this one is kind of nice, or you could say this one is kind of nice. What kind of shape is that? If this
Kind of
if this was-
geographic.
yeah, that's good. If this was on the back of a lens, of an IOL lens, what would you describe the shape as? Or if this was on someone's skin, what would you describe the shape as?
Irregular borders, maybe serpiginous.
Keep going, keep going. How about like placoid? Kind of looks like a placoid. Do you ever hear that? Right. So like on the back of the lens, we say like it looks a bit placoid material appearance, but this is also placoid in appearance. Sometimes serpiginous can have this appearance as well. Okay, so now you have it's multiple, it's placoid, and let's just say this happened in a couple of days to weeks, so it's acute. So what do you think this is?
I guess ampy.
It's ampy. Okay, now ampy, the other thing that, it's going to be hard because this could be serpiginous as well. Why not? Mudes, I'll show you how, but the thing that gives it away is the FA. On FA, just like I said in birdshot, there's quenching of the dye. And I didn't show you an FA, but there's quenching of the dye on FA. Here, there's pathognomonic because on FA, on early FA, the placoid lesion is actually what? Hyper or hypofluorescent?
Looks hypo.
It's good. So early it's hypo, and then later we'll look at here. Now it's hyper. So if it's early blockage, late staining, that's ampy. Early blockage, late staining. They don't have to even show you this color photo. They don't have to show you this, which will show you that it's multiple and it's placoid. They could just show you this and it's automatically ampy. Okay, because birdshot is quenching, ampy is early blockage, late staining. Okay. Demographics.
I do not know, but I know that lots of these white dot syndromes involve like middle-aged females.
We'll come back to that then. How about imaging? We just said early blockage, late staining. What do you think the treatment and prognosis is? So let's go over to.
I don't know. Yeah.
Perfect. That's okay. Let's go over. This is my mnemonic for ampy. When I think of ampy, I think of an amp. Okay, it's just an amp. Same picture, placoid lesion, early blockage, late staining. But let's talk about the demographics. This one's interesting because this one is actually equal, men and female. All right, and it's healthy young adults. Just like most of the white dots, but this one's equal gender. Okay, so when I think of ampy, I think of music. And then I think of, you know who this is, Carl? Anybody know? Yeah, anybody know who those guys are? Oh my God. I mean, it's funny too, because I get it. I'm a little old, but I don't think I'm that old. This is the White Stripes. This is Jack White. This is like Seven Tower Army, like Seven Army Nation. Anyway. This is the White Stripes. So just, it's a guy and a girl singing in the band. They're pretty good. You guys should listen. And then you'll see photopsia. So just imagine you're at a show and they're taking pictures of them. And then just imagine somehow that on top of the ampy, there's a box of napkins. So there is a 50% prodrome. What's making the ampy kind of blow up a little bit because it's raining in the stadium. So that's kind of from the vitritis. And then while you're watching the show, it's incredibly like, you know, riveting. Why, Carl? What do you worry about an ampy? You're mind blown.
Well, based on what I just saw in the picture, I guess systemic vasculitis in the brain.
Yeah. You're worried about cerebral vasculitis. This is probably the most important of all the white dots. AMPI is associated with cerebral vasculitis, which could kill a patient. So you have to get an MRI and you have to start steroids if the patient has cerebral vasculitis. Okay. The way that I remember this is you go to a concert, you've got a bouncer in the front, so he's going to have early blockage. Then after the concert, they kind of stain the area, some graffiti, so late stain. And then lastly, you could always remember that it's kind of a good show for the most part. It's acute vision loss, but it resolves on its own in weeks. So it's a good prognosis. However, if there's cerebral vasculitis, if the patient's having any kind of brain issues, and you get an MRI, MRA, and the MRA shows there's cerebral vasculitis, you have to start steroids, but obviously rule out TB and RPR. That was a hard one. That was a hard one, but a very, like a good one. And it really, again, it's based off of this picture. Early blockage, late staining. Okay, we'll go over it again. All right. Danny, you want to try? What do you think this is?
So on the fundus photo, I see looks like maybe some atrophy with some
Yeah.
areas of hyperpigmentation.
Can you describe, it does look placoid, right? But it's primarily around, instead of the placoid that's kind of being separate from the nerve, this one's placoid and it's what?
Peripapillary, and then it extends out to the macula.
Perfect. Imagine this was really bad and this looks pretty bad. What do you think this could be of all the white dots?
I'm not sure.
Have you heard of the serpiginous? That's okay. We'll go over everything, I promise. So this is one of the white dots. It's serpiginous. Serpiginous is bad. Okay, serpiginous kind of looks like ampy, but it's really around the optic nerve. Okay. All right, let's talk about what serpiginous is like. All right. So serpiginous also, you know, 20s to 40s, and it affects gender equally. When I think of serpiginous, I think of Harry Potter. Okay, and the reason why is it's funny, when I asked you guys last year, you said, oh, because of Slytherin, which I probably should have included, but it was really because of Professor Snape, who looks like a snake. Okay, so it's poor vision. Remember this guy, he's got poor vision. He's also in Harry Potter. And serpiginous is, go ahead, Danny, you could read all of them. How about that?
Okay. Prognosis is poor, even with treatment.
Yeah, because Professor Snake dies at the end, doesn't he? And that's a poor prognosis right there.
Serpiginous is relentlessly progressive and destroys RPE and photoreceptors.
Mm-hmm.
And then on the FA, you get hyperautofluorescence at the leading edge.
Yeah, so that's my bad. I wrote hyperautofluorescence. That's on FAF, but on FA, it should be a hyperfluorescence. And I just think of a snake, which is serpiginous, driving some kind of car. So imagine at the leading edge over here, you see how at the leading edge, there's hyperfluorescence. This means that it's still active. If this was all dark, then it would mean it would be inactive. So the way to test if this guy's serpiginous disease is acting up is you do the FA, and if there is a hyperfluorescence at the leading edge, oh, you got to keep still treating him. Cool. All right, how do you treat him?
With steroids, but you have to rule out syphilis and TB first.
Yeah, just remember a snake on steroids. Okay. if you have another way of remembering it, I'll put Slytherin on, and then maybe I'll put one of these guys on steroid or something like that. Okay, good. We'll come back to it. You guys did great. All right, who's brave? Anybody want to volunteer? You might as well volunteer now before the OCAPs make you forcefully volunteer. All right, Ryan. What is the diagnosis, bud? Well, we already did birdshot. We already did ampy. We already did serpiginous. There's a few left. What do you think this could be?
Potentially thinking mudes.
Okay. What else?
Or is this okay, so it's bilateral. Okay. Mudes or multifocal or PICs are the ones that I have
Nice.
in mind.
Very good. So you got mudes, you got multifocal chorditis, and you got PIC. Okay. What is the difference between all of those? Let's say it's bilateral. Okay.
Mhm.
This is the right eye. This is the left eye. Which one is usually unilateral?
Mudes and young
Mudes.
female.
How do you remember that? How do you remember mudes is unilateral?
Well, it's kind of my own mnemonic, but mudes, I somehow think of a young female cat, and has like a problem in one eye. That's how I remember
That's not
it.
a bad way of think about it. That's not a bad way. I like it. Mudes, young cat. So I think of just unilateral. It's unilateral. Okay. But this is bilateral. So it crosses out mudes. So now you have MCP and you have PIC.
Mhm.
What's the difference between those?
I think PIC, like the lesions are smaller, kind of like
Much
what you
smaller.
see in the fundus photo.
Look at these pictures. These are big boys. These aren't punctate. PIC is punctate interchoroiditis. This is not punctate. This is big. This is, but they're also multifocal. So you're left with MFC.
Multifocal, yeah.
Good. Excellent. MFC, demographics.
Middle-aged.
Okay.
Like
Females, males.
I thought maybe it had like slightly higher female predilection.
Good. Symptoms.
Photopsia, floaters, and
Good.
just poor vision.
All right. Do you have vitritis and MFC?
Not as much.
You do.
You
So
do?
you do. The ones you don't have is with PIC. PIC is not going to be that much vitritis. So there's two things where there's no vitritis in retina. If they say there's no vitritis, what are the two things? And the person's not immunocompromised. What are the two things that it could be? They say there's no vitritis. Anybody can answer.
It's gotta be like
PIC and
deep in the
toxo.
forehead.
No, Caitlin, go ahead. What is it?
Yeah, PIC and toxo.
PIC, not toxo, but
Oh,
close to
histo.
histo. PIC and histo. If they ever say in the question stem, there's no vitritis in your brain, you should be like, okay, where's PIC and where's histo? Or you could obviously think, oh, this person could have HIV and whatever, and they can't have a vitritis response. Okay, let's do it. So the way I think of MCP is I think of an MC, and let's just make her name P. So her name is MCP, and she's literally saying, I'm MCP, and she's dropping her glasses, so she's myopic. She's also dropping her cane, so enlarged blind spot. She somehow has a sword, so vascular sheathing. And again, she's wrapping, so people are taking pictures, photopsia, and she's outside, so there's vitritis. Okay, so go ahead, Ryan, read all of those.
So the lesions are usually in between 50 to 200 microns in diameter. And there are like choroidal lesions in the posterior fundus. Typically happens in young myopic women, has vascular sheathing, could have enlarged blind spot, also could experience photopsia, treatment is steroids, and this is one of the conditions that have vitritis.
Yeah, totally. Okay, versus this one. Let's see. Aish, do you know this one? You wanna-
Well,
So we just said there was kind of two left.
Yeah, so those little white dots look punctate.
Very good. Yeah, this is PIC. All right. So what was the difference between PIC and MCP?
I think pick there isn't vitritis.
PIC. That's really what you got to know. Those two things. This looks like PIC because it's punctate and it's small. And number two, there's no vitritis. The third thing that you also have to know is that these patients with this white dot, they're more susceptible to this long term compared to all the other white dots. You know what it is? It's a hard question, but it's actually right here on this picture. What does this look like? And then if you do the FA, obviously it's the wrong guy, but whatever. If you do the FA, you'll see it here. What could that be? Don't think too hard about it. Just think simple retina doc.
Honestly, not too sure.
That's okay. Let's just imagine this guy has bullseye maculopathy. Long term, you monitor her for this. This person has AMD. Long term, you have to monitor for this. This person has choroidal rupture. Long term, you have to monitor for this. What do you think this could be?
Just like CNV.
CNV. It's CNV. Okay, so with PIC, they have a high likelihood of getting CNV. I did not mention CNV with birdshot. I did not mention CNV with AMPI. I did not mention CNV with serpiginous, even though serpiginous can get it as well. But I am mentioning CNV with PIC. Cool? All right. So with PIC, I think of the girl in class that says, pick me, okay? But she's in class, so there's really no vitritis, okay? She's in class, so it can't rain on top of her. Cool. All right, Aish, go ahead and read everything.
So you have like white, yellow, chorioretinal lesions, usually 100 to 200 microns in diameter.
You remember how big the other one was with MCP?
What was that, 200 to 300?
Yeah, about like 200 to 300. It's a little bit bigger. Okay.
Okay.
Okay, go. Sorry about that.
Okay, and then it's at the level of the inner choroid and the RPE.
And that's why there's a diminished A wave for all of these, except for birdshot. It's a diminished B wave because all of this is inner choroid and RPE. A wave and B wave and on ERGs are dependent on the level of the retina. If it is a choroid in the RPE, that is an A wave. If this is inner retina, meaning that it's, near the vitreous, inner retina, that is the B wave, but whatever. I'm just saying all of these are pretty much inner choroid and RPE, except for birdshot, which is a B wave. This is why it's a wave. Keep going.
Okay, so it typically affects young myopic women.
So look at the glasses on her desk. Keep going.
And people who are younger than in MCP.
Yeah, this is a girl in class. She's younger than a girl who's rapping. Keep going.
It's usually bilateral.
Those are the two girls who are kind of right behind each other, but one's a little smaller.
And then about 79% have CNV. And on imaging, on OCT.
What's the treatment? What's the treatment for CNV?
Anti-VEGF.
Perfect. So just remember you're in class and sometimes a teacher puts on television just to make you watch the show or whatever. You just imagine you're watching CNN instead. 79% have CNV. Capiche? Keep going.
There's no vitritis on exam, and on imaging, there is focal easy loss and RPE at the fovea, and then the FA shows window and staining defects from loss of layers.
That makes sense. That makes sense. On FA, obviously, if there's any kind of loss of layers, you're going to have a window defect. Obviously, with whatever you see, you'll have a little bit of staining. Who cares? But if there's CNV, what do you see on FA?
Leakage.
Perfect. Then that makes sense. You'll always see leakage with any CNV, whatever it's coming from. Cool? Cool. Good job. All right. Let's see. Jahan, what do you think, bud?
You gave me the easiest one because we could
Did
rule
I?
everything out.
Did I? This could be a trick one.
Could it be? You tricking me? Well, all that's left is mute, so I'm just gonna go ahead and say mutes.
Good, it is mute. What do you see on the FA?
On the FA, so this is, I would just say late or probably like peak phase. You see like areas of hyper and hypofluorescence, like in the choroid, like little punctate areas of you see the Christmas wreath. Isn't that what you're
Yes,
supposed to see?
yes.
Yeah.
This looks like a Christmas wreath, man. It looks like
Yeah.
it's hanging on your door. You know what I mean? All right,
Yeah.
sounds perfect. It's exactly it. What else is good with mudes? What else did we say? Is it bilateral or unilateral?
We said it was unilateral.
It was unilateral. Demographics.
That's the young myopic female, right?
It is very good. And then imaging, you already said wreath-like spots. And then what is the prognosis for these people?
Isn't it pretty good? It like resolves in a couple weeks.
Yeah. So this is weird. This is one day when I was on call. I don't think I was thinking that well, and I don't think I've ever changed it. It just stuck with me. So mudes, I think of, you know how sometimes you've got the rodeos and the people get on top of the horse, whatever, the cow, and then they shake. All right. So just imagine this girl's kind of on that bull that's kind of like going around because it's young myopic females. People are taking pictures of her. Somehow the bull has a wreath on its head. Somehow the bull is also eating a piece of tissue paper because there's a viral prodrome, all that good stuff. So go ahead and read it all.
Yeah, so it's mutilateral. You get the enlarged blind spot. You get the parafoveal white wreath-like dots or spots. You get for symptoms, you get photopsias. You see it in a young myopic woman. You have that 33% have a prodrome. On FA, you see the early parafoveal hyperfluorescent granular wreath-like spots.
Ooh, that's a mouthful, but I'm telling you, that is exactly what they're going to test you on. Okay, granular, it looks kind of grainy, and then wreath-like spots. That's exactly what it looks like. All right, keep going.
And then you get a diminished A wave on ERG.
Pretty much all of them are going to have a diminished A wave, except for starts with a B.
Birdshot.
Birdshot starts with a B, and it's a diminished B wave. Okay.
Yeah.
Now, diminished B wave is also seen with anything that affects the inner retina. What affects the inner retina? Central retinal artery occlusion affects the inner retina. Central retinal vein occlusion affects the inner retina. So those have diminished B wave. You know, JXR has a diminished. There's a lot of stuff that causes diminished B wave. But when it comes to white dots, only birdshot is a diminished B wave. Everything else is diminished A wave. And again, if you keep going, it'll say that there's ISOS RPE disruption, and that's what causes the diminished A wave. But that's pretty non-specific. This could be seen with multiple of the white dots. And then good prognosis, like you said, recovery in usually 2 to 6 weeks without treatment. So you don't have to give these people steroids usually. And this one's kind of interesting. You may actually just, it's not that common, but you'll see it. I mean, at least one of you guys is going to see it in their residency. Just a random girl coming inside saying how she can't see that well. She had some kind of viral prodrome about a couple of weeks ago. And when you look inside her eye, you'll see these whatever white punctate wreath-like areas. If you do the FA, which you don't have to, because again, it's going to be recovery in 2 to 6 weeks. So what's the purpose of doing the FA? She'll feel better in 2 to 6 weeks without you even having to treat her. Cool. This is the last one, and this is probably the hardest one. So unless anybody knows it, but I'll just talk about it. This is Azor, okay? This is acute zonal outer retinopathy. With Azor, it usually also affects around the nerve itself. There's usually what you go by is visual field defects. I did not show you a visual field on any of the other white dots, but I did show a visual field for this because with the Azor, they love testing the visual field. So with the way that I remember we bought a zoo for Zor. It's also young, otherwise healthy female. Their complaint of vision loss is in terms of visual field defects. And then FA, they'll have like window defect related to the loss of the RPE as well as around the optic nerve head. Okay, the gene stuff, don't worry about that. We'll talk about that after. but let's go over it again. Let's test your memory. All right, Caden, let's do it. You still there? I don't know if he's still there. No, he's not. All right, let's see. Let's see. Hey, Ryan, let's do this.
Birdshot.
Good. Really quick, as fast as you can, all the stuff that you could think of, diagnosis, demographics, symptoms, all that.
829.2 Caucasian, symptoms, photopsia, floaters and decreased vision. Yeah, associations 829.2. Imaging, you could do ICGA, and also
What do you
could
see on
FA.
FA? What do you see on FA?
You see a lot of these like kind of
Keyword,
small,
buzzword.
like
A little bird that has a Sprite bottle. Quenching on FA. Cool. I think I lost him. Yeah, think of quenching. Okay. And then B wave, diminished B wave. Yes, you're right. HL 829. Okay. Carl, go.
All right. So this is AMPI, right?
Good. Graphics.
So this is male, female, equal, relatively young. Symptoms of photopsias, there's vitritis, early blockage, late staining,
Nice.
steroids. Yeah.
What are you worried about?
Oh yeah, cerebral vasculitis. killing
Good.
the
What do you need
patient.
to do imaging for that?
So do an MRI.
If they do have cerebral vasculitis, how do you treat?
Steroids rule out TB
If
and
they don't
RPR.
have any cerebral vasculitis, do you have to treat?
No, relatively good prognosis.
Excellent. Excellent. Cool.
Oh, viral
Danny.
prodrome. There we go.
Viral. I forgot about that. But you know, this is 50%, so it's such a horrible statistic, but nonetheless. Danny, go for it. You're on mute.
Thanks. Serpiginous.
Yeah.
Demographic, I think it was both genders equally. And then symptoms, I think it was photopsias.
Good. Is this as good as AMPI? Like good recovery with AMPI?
No, this is worse prognosis.
Excellent. And then what do you see on FA?
On FA, you see hyperfluorescence at the edges if it's active.
Excellent. Perfect. Cool.
Steroids, okay.
Nothing else will really kind of look. Now, the thing about serpiginous, by the way, and as well as with AMPI, as well as with whatever, is that this could always still be syphilis, right? This could always still be tuberculosis. You still have to rule that out. If this was India, it'd be tuberculosis, by the way. Even if it's it looks like serpiginous, if this was India, the patient most likely has tuberculosis. Yeah. Okay. Aish.
This is PIC.
Yeah. Demographics.
Demographics, usually women more than men, but they're younger than in MCP.
Good. What are you worried about
You're worried about
in the future?
CNV in the
Yes,
future.
you are. And then how do you treat that?
You treat it with anti-VEGF agents.
Good. And then what's the difference between this and MCP? Two differences.
So this has vitritis and
This has vitritis?
or no, MCP has vitritis.
Good.
This does not have vitritis, and then the size is different. So this is 100 to 200, and then I think MCP was like 50 to 200 microns.
Yeah. All right. Very good. Very good. So no vitritis is the big one, and then it's a little smaller. It's more punctate. Good. Excellent. All right. Jahan. You're on mute, bud.
Okay. So for this one, it is mudes.
Yep.
Yep.
Demographics.
So the demographic is young, myopic females. Symptoms are photopsias. On imaging, you get the early the early granular wreath-like shapes, hyperfluorescent wreath-like shapes. It's usually associated with a viral prodrome, and prognosis is good. They usually resolve in a couple weeks.
Super good. Super good. Pretty sure that's it, guys. Okay, last one. If anybody could remember what this is, go ahead, Sejal. What do you think this is?
So this is Azor, and you have like this disc finding. You get the visual fields. That's how they'll test you on it.
Yep.
Others.
That's pretty much it.
Yeah.
It's pretty much it. They're going to make it very simple. If they're going to test you on Azor, they may combine Azor with something called APC, which is acute idiopathic blind spot syndrome. But APC, they say, is kind of under the whole umbrella of white dot. But Azor, they love visual field defects because nothing else kind of will help you. It's just very non-specific. Their retinal findings, their FA findings. So, but their visual field findings are usually, they'll always complain of that. So they have to show that to you. Good job, guys. It's up to you if you guys want to do some more with this, I'll be happy to, but I think for white dots, that's pretty much it for white dots. If you remember those kind of key buzzwords on each of these pictures, you guys would do fine on white dots. Just obviously the way that they're going to test you on white dots is they're going to compare mudes with PIC with MCP. So, you know, if they have a prodrome, don't say, oh yeah, prodrome. I remember mudes has a prodrome. Well, a bunch of them have prodromes. So you have to go with whatever is kind of individual. Wreath-like, it's got to be mudes. Unilateral, it's most likely mudes. If it's, you know, younger and it's kind of in a boy, then it may likely be AMP. Early blockage, late staining, that's pathognomonic for AMP. Cerebral vasculitis, big one for AMP. Okay, anybody have any questions?
Thank you.
Have a great day, guys.
Thank you,
Thanks,
Mo.
Thanks,
Of course,
Mo.
bro. Bye, y'all.